Okay, we're here at the conference on ethics of care in Stuttgart in October 2013, and I'm very happy to be here with Professor Marian. She's a professor of social policy at the University of Brighton. Welcome.
Thank you.
Could you tell us a little bit about yourself and your research?
Well, I am a professor of social policy, and my research has covered a wide range of areas, but the particular areas of most relevance to this is work both around collective action amongst users of health and social care services and the way in which they have tried to shape and influence policies and services. And more recently, I've been doing work around older people and older people's well-being, and working with ideas of care ethics both in the way in which we have been researching with older people and in making sense of, in understanding what it is that they say is important about well-being to them.
Okay, thank you. And the actually the topic of the conference is Deliberation and Transformation, Challenges to the Ethics of Care. How does that relate to your research?
Right, yeah. I mean, in a number of ways. Firstly, I suppose the general point that I discovered in the ethics of care a very useful way of developing a critical framework that engaged both with people's lived experience, the way in which they understand and negotiate care within their own lives, and also the political issues about how we make decisions about collective responsibilities for care, what we are prepared to pay for in terms of care, and also the ways in which we make policy decisions with care or not with care. And so the perspective that Selma Savenhuisen has offered in understanding the need to renew the way we understand policy from an ethic of care, so to renew, refresh, transform our thinking about care, is one that I've found very helpful in my own critical policy work. But the other aspect of it, the deliberation, I have reflected back on work that I've done on participative governance, participative policy making, where I've worked with ideas of deliberative democracy and have used care ethics as a way of proposing, if you like, alternative ways of thinking about what deliberation should involve and how we might evaluate it.
Okay. And is there anything specific you hope for to achieve with this conference, or that that you're looking forward to or wish for?
I think one of the things that this conference is very explicitly trying to do is to bring together not only different disciplinary perspectives on the ethics of care, but also bring together academics and practitioner perspectives. And for me, that dialogue is a necessary dialogue. That I'm an applied social scientist, and theory is very important to my work. I feel the need to work with it, but I also feel the need to engage with people's lived realities, the actual practices and activities that people are engaged with. And what I hope for from both this conference and the way in which the network develops is that it can encourage and facilitate that sort of dialogue.
Okay, thank you very much for your time.
Thank you.